Hello, everyone. Welcome. It is time for CBD with your favorite PhD. And as always, we welcome Dr. Katerina Rosakis. Dr. Kat, good morning. Thank you for joining us again.
Good morning, Carmen. Good morning, everybody. Happy Monday.
Happy Monday. Dr. Kat, we have already had several webisodes and we've talked about hemp CBD and pain management. We've talked about hemp CBD and, anxiety and depression. And we've talked about how to sort of be a little discerning in reading some of the labels. And we've had some requests to continue down those other topics and just maybe dive in a little bit. But for today, we thought that we would dive into the question of sleep issues and how does hemp CBD help folks with that are dealing with sleep issues.
Okay, thank you, Carmen. Sleep is one of our number 5, if not second, third, sometimes first question. It is very important. Statistics show that most of us have been affected by sleep or are affected by sleep. So I recommend that whoever's watching today, please share because this information is very important. And our goal is if we can help somebody, that's even one person, we've accomplished a lot. And this is not just about CBD. This is the alternatives, and CBD will be included. So you're not just going to hear CBD, you're going to hear me talk to you about sleep and addiction, and of course, why CBD can help, and some recommendations, some alternative recommendations along with either supplements or behavioral change.
So we're broadening the discussion a little bit.
A little bit, because when you're dealing with sleep, when people come into the practice and they complain, whether it's pain, depression, anxiety, very similar to bipolar disorder, we see that the underlying cause can be sleep. So it is one of the biggest parts of our assessment.
Right.
And we see this across the practice. Statistically, 50 to 70 million US adults report sleep disturbances. That's the people that report it.
Right.
Okay. Right. So this is a very big number.
Right.
And again, I always say it could be you, your spouse, your family member, a sibling. We're seeing it with kids now with gaming. And there's a whole different statistics for young, I would say kids below teens or teens. So we're going to be talking about older teens today and adults.
Okay. And so we're talking about sleep deprivation, basically.
We're talking about how to get quality of sleep, why people may not sleep well, how it affects your health, the medical issues that it causes, and how to get some good rest. Okay, and issues of addiction, because one of the things that I'm trying to advocate is, to utilize less opiates and have a healthier society, because we see a lot of suicides, constipation, medical issues, destruction of families. Even with addiction of sleepers, Ambien, is used as a sleeping medication by many people, and they come and they say, I'd like to get off of this or only use it as needed. Is there an alternative? So that's another question. So many questions around sleep. That's why I'm saying share.
Right. Exactly.
And because these are nuggets, I'm going to go through them pretty quickly so that you can hear and grasp what you need. But if you need additional information at the end of the presentation of our nuggets, I'll let you know how to reach us and how to get help.
Exactly.
Because it's a simple solution. It just requires some assistance. Adults need 7 to 9 hours sleep, and teens need 8 to 10 hours sleep. And that depends on our genetics. Some need just a little bit more, some a little bit less, but this is a national average. There are causes of sleep disturbance. So why don't people sleep? You may overeat at night, drinking caffeine in the middle of the day, inflammatory issues that can result in pain or agitation. We know PMS is an inflammatory problem. Worry, where the mind is overactive, anxiety, where your heart's racing and you're feeling very uncomfortable. Medications, restless leg, sleep apnea. I cannot even begin to tell you how many people have sleep apnea, and thank goodness for sleep studies that are helping give people more oxygen. Restless leg, especially these days where people can't get out and walk, we're seeing a little bit more in the bed. Depression, Parkinson's disease, dementia, and many other problems, medical issues, cardiac, post-surgery, they affect our sleep. And how many people did I just cover? How many of you are experiencing any of these? There are people that come into the office, and I would say over 75% of them, their problems improve with sleep improving. It's not the only thing because we teach skills, but we see a huge improvement. Now, if you're not sleeping well, you can actually have problems at work. You can have, did you want to ask something?
No, no, not at all. We're listening. I'm trying to see if there's any questions while you're chatting. So go ahead.
Okay. It can affect our focus and our concentration and our judgment. And there are deaths that are related to work errors. And it's a big number. And people don't, think about that, if your judgment or you're foggy, people can fall, and you have
Sure.
to be very focused in many jobs. Heart disease, the effects of lack of sleep, because heart disease is inflammatory, but our heart needs rest. It's also a muscle. Decrease in libido. This is huge. A lot of people don't talk about this. And actually, CBD helps with libido, and we'll talk about why, but that will help with sleep as well. All of these things are like the chicken and the egg, or the egg and the chicken.
It's right. It's all connected.
Yes. But we know that sleep causes these problems, and then these problems continue to affect your sleep. Hormone irregularities. Sometimes the hormones don't let us sleep. We don't sleep, our hormones get affected. Weight gain. We know that when you sleep well, it's easier to lose weight. Diabetes, depression, aging skin. There's not enough that we talk about. People, when they don't sleep, they don't feel like they look good, but it actually can age your skin because, again, oxygen when you're sleeping. When you sleep, your body restores itself. It's where everything goes to bay and we replenish the things that we use during the day. Memory issues we talked about, fogginess in the brain, difficulty concentrating, poor judgment, and of course an increase in inflammation, which I mentioned and I can't mention enough because you've heard our presentations around CBD inflammation, CBD in the heart, CBD in pain. So I'm not going to repeat those today. Those are in other episodes because we do talk about how CBD helps those things. So if you help those things, you will help your sleep. There are things that you can do to help your sleep. When you come into the office, we teach something called a sleep hygiene. And that is a routine. And it covers everything from your pajamas to your room temperature to meditation, and doing this consistently. And we have found very successfully that helps. And CBD is included in that sleep hygiene. When you take CBD, we're curious, how can that help? Well, your sleep hygiene can help. Seeking psychotherapy can help, but CBD itself helps reduce anxiety and helps with depression. We're having more and more findings, reports, and research coming out on that. Again, reducing inflammation, because if your body hurts, it's very hard to sleep. If you have post-surgery, arthritic issues. Most illnesses are affected by the inflammation. So again, full circle here. There are studies coming out with Parkinson's, and we need to be very careful. We know that CBD is neuroprotective, but what we're using it for, because we know this component, is that it helps with all the other symptoms. And with Parkinson's, people have the worry, the difficulty sleeping,
Of course.
anxiety comes along with it. And also cancer treatments. With cancer treatments, you're on steroids, which keep you awake. And your body also can hurt from the medications. It can affect your bones, and CBD has helped with that. So I think the other thing I want to talk about is the addictive component. I mentioned that earlier with Ambien, and we're trying to reduce addiction. And a lot of people are desperate to sleep. You know, they'll get up, they'll pace, and we don't sleep, our mind begins to worry. And I think it's very important that we look at the alternatives to include CBD. Again, it's not a be all. There's many things you can do, but it is there and people are using it. Now, one of the ways CBD works for worry and anxiety is that you may have thoughts when you want to go to bed, but when you have thoughts and they're repetitive and you're worried, your heart starts to race, your adrenaline starts to come out. With CBD, those physiological effects don't seem to happen. So you can have the thoughts and drift off to sleep. You're not going to get sedated. You're not going to get high. So some people try the CBD and they're like, "Oh, I'm not feeling anything." But I slept.
Right. And we're talking specifically, our show is about hemp CBD. So
Absolutely.
we just want to make sure and clear that that's the topic that we address here.
Hemp CBD is non-psychoactive, and research is showing that it's helping even with psychosis, with elderlies with Alzheimer's. And I've been posting a few stories because I work with seniors as well and their families, and trying to prevent them from getting on psychotropics, to help them be calm during the day, not agitated, and to have them better regulated sleep at night. And we're seeing they're having less psychosis, which has anxiety, keeps people awake, and it's so promising. It's amazing.
Right.
So in a nutshell,
Mhm.
sleep is a major issue. It doesn't have to be. There are solutions. There are routines that we can improve on. There are foods that we can avoid and foods that we can eat, and alternative supplements that we can take to avoid just popping a pill and worry about the negative side effects of a prescription medication that can be addictive.
Right. And that's the other, just I wanted to make sure that we're highlighting and explaining the addiction component. You
Yes.
were talking about the other medications that can create an addiction for someone, and how hemp CBD can help, get them off of those that path, basically.
Yes, Carmen. And I'm glad you brought that up because I mentioned sleeping medication, but a lot of people are taking pain medication to help them sleep. As a matter of fact, I spoke to somebody yesterday, and they were on a very strong pain medication. And I said, "Why are you taking this? I thought your pain was managed." And they said, "Well, it knocks me out." And I'm like, "What else have you tried?" "Well, I tried that for my pain, and now that my pain's gone, since it helps with my sleep, why would I need to come off?" Sounds a little bit of addictive to me, but also convenient, a
Sure.
solution, because people struggle when they
Sure.
don't sleep. You're not alone. We can get irritable. We can argue with our loved ones. So we can, I've heard so many parents say, especially with parents at home right now with children
Mhm.
having to work and they're tired, their tolerance level goes down. So they need really good rest. And who's not worrying today with COVID, the fires, not the disasters, the election? A lot of people are struggling, and so they're
Sure.
lashing out. They can be lashing out at their children, at their friends and spouses, and that's not who we are.
Right. Well, thank you so much, Dr. Cat. I know that we sort of try to like contain these webisodes to an
Sorry.
X amount of time. But I think that the important thing is that we are diving into these questions, and you're able to give us these insights and clarifications. So I feel like that's just much more important. But also, this isn't a full consultation. This is every person's situation is different. And so if someone wanted a consultation with you, or a member of your team, how can they contact you?
Please don't hesitate. A lot of people feel that they're bothering, the health professional, but that's what we're here to do. So you can reach out at Insight for Wellness, INSIGHTFOR wellness.com, or call us on our main number at 925-216-3510. And we have a few CBD consultants, several psychotherapists, and other alternative healthcare providers. Call us and say hi, and please put your questions down, because we will get to them, and we love them. I love the questions.
Exactly.
They're all very similar, but so important.
Yep. Great. Thank you so much for your insight, Dr. Kat. We really appreciate it. I know that people share these lives, and they have watch parties, and you'll always put your information in the thread. So we thank you all for staying with us. This has been another webisode of CBD with your favorite PhD. Thanks so much. We will see you next week. Bye-bye. Bye, Dr. Kat.
Bye, Carmen. Bye, everybody.